So, welcome. So nice to have you, Kim Kushner. And you are a clinical nutritionist and naturopath of over 14 years. And I'm really delighted to have you on board today because you help so many people with their chronic and complex health issues, and yet you have so many health issues yourself. So, I do appreciate having you today and your willingness to share with the audience.
Thank you.
You're welcome. So, Kim, can we start first off with what brought you to become a nutritionist and a naturopath?
Yeah, so I'll go a little bit into my upbringing. So I grew up in Bali in Indonesia. My mom's Indonesian. I grew up there and natural medicine was just a normal part of life. And I was attracted to um natural remedies and herbal medicines. And I grew up in a pretty health conscious household. So eating well and nutrition was always kind of a focus of ours as a family. So, graduating high school, I really excelled in the sciences and I loved human biology and I loved food. And I thought, you know what? I'd really love to delve into the world of nutrition. And yeah, and then just delved into tertiary studies. I actually started studying dietetics, um, but I realized it wasn't quite the route I wanted to take. And that's when I delved into more specifically nutritional medicine.
So, because of that, you studying nutrition and being a naturopath, but then at the same time, was it around the same time that you were experiencing some of these complex health issues? So, for example, your endometriosis is one of them. So, can you tell me when were you experiencing the symptoms? Was it at a young age? Was it when you hit menstruation? When was that?
Yeah. So, um, when I started getting my periods at the age of 11, from the onset of the periods, they were incredibly painful. So, officially, I would say yes, when I started menstruating at the age of 11 was when I started experiencing symptoms.
Yeah, that's young too, isn't it? And so what happened down that pathway? Were you already getting investigations then, or did you think it'll ease out?
Yeah, no. So, symptoms continued for a long time. It took me officially 12 years to get a diagnosis of endometriosis. I was
How long?
12.
12 years. That's a
Yeah.
long time.
Yeah. So we're seeing an average time of about like 7 to 10 years is not uncommon for a diagnosis. So women are really struggling for a long time and going undiagnosed and being told it's normal and it's part of being a woman when when it's not normal at all. So yeah, I was handballed from doctor to doctor and I had my first colonoscopy and gastroscopy at the age of 15. I was put on PPIs at the age of 15. I was on Nexium and omeprazole at 15 for years, as well as hormonal contraceptives. So, yeah, I was misdiagnosed with, IBS and seeing gastroenterologists and put on pain medication and hormones. And yeah, eventually, amidst a really bad flare, I was finally given a referral to a gynecologist who specialized in endo and he said, this is classic endo and we're gonna do a laparoscopy. And lo and behold, that's when I was diagnosed. So yeah, it's
Wow.
unfortunate. And my story is not uncommon. I think there's an estimated 200 million women in the world with endo. And if you consider the time it takes for a diagnosis, it's highly likely that there are a lot more than that
And
undiagnosed.
yeah, I bet. And just to clarify, that endometriosis is where that tissue is found, where it should be in the uterus, is actually found outside the uterus, isn't it? In other parts of the body.
Endometriosis is where you find tissue which is like the endometrium or the inner lining of the uterus in implanted in other organs, other areas in the body. So it's not exactly the same as the endometrium, but it's like the endometrium. It behaves differently though. And it has some similar characteristics and traits when you look at it from like a histopathological perspective, but it's not the same as endometrium. And it can be found anywhere on any organ, really.
And you talk about in your work in your private practice helping women with endometriosis and that you dive into the core drivers, for example, the inflammation and how it affects the hormones, the hormonal imbalances, immune dysfunction, your microbiome health and how that can influence the inflammation, the nervous system and the vascular health. So, can we just touch on a few of those things and how are they core drivers that connect with endometriosis?
Sure. So there are a number of theories as to the cause of endo. Now, I just want to clarify, we don't officially know the cause and we don't have a cure, but we look at the root drivers of symptoms and we know that there is a significant immune dysfunction component in endometriosis. And we know that there's this chronic systemic inflammatory state. And so these all need to be considered when we want to treat or address the human rather than just the label of the disease. So you touched on the gut microbiome then, and I love talking about this because it's one area that naturopaths and nutritionists are really passionate about, and it's an area where more and more research is emerging. Um, but yes, our gut microbiome can have a significant influence on our immune system. It basically talks to our immune system. It can, if you have overgrowth of opportunistic bacteria, pathogens, a dysbiotic gut environment, which essentially means like an imbalanced gut microbiome, that can drive inflammation, not just locally in your gut, but systemically. It can send your immune signals to go haywire, essentially. So we always look at the gut. And in a lot of women with endo, regardless of whether you have endometriosis lesions on the bowel or not, I think it's about 80 or 90% of women will have digestive symptoms. So we always address the gut. So the gut, we want to make sure that we're nourishing the gut, we're looking after the gut microbiome, we're encouraging and fostering an environment which is conducive to a healthy gut microbiome. Your gut microbiome has a role to play in the detoxification of estrogen. And we know that endometriosis is a very pro-estrogenic or estrogen dominant condition. So yeah, that's a little bit of the naturopathic perspective.
And you say that 80-90% of women have digestive issues. Is that because that tissue is found in the bowel?
So you can have endometriosis lesions that grow on the bowel. So we see that a lot. So I personally had bowel endo. Now it's not inside the intestinal lumen. It's on the outside of the bowel wall. And it can
Right.
often, you see this like frozen pelvis situation where women have organs fused together and adhesions forming and lesions on the bowel. But regardless of whether a woman has endo growing on her bowel or not, it's highly likely that she's going to have gut symptoms. So there's this term that we use in this space, and it's called endo belly. And it's this like distended, almost pregnant looking bloated belly that women get because of this inflammation and pain. Um, so yeah, you don't necessarily have to have the lesions on the bowel to have the digestive symptoms. In
Right.
fact,
So you could even see that in a young girl of menstruating age is that distended belly.
absolutely, young girls with period pain, um, gut issues. I mean, I was diagnosed with IBS. I was put on medication at such a young age, and but I did have endo growing on my bowel. Um, but yeah, those are red flags in young girls for sure.
And then nervous system regulation. How's that connected to endometriosis?
Really interesting research coming out about the endometriosis brain. And I think you're going to see this in many chronic conditions that involve chronic pain. And that's that your Your brain, as we know, is neuroplastic. It can rewire based on what we're thinking, what we're doing. Now, imagine someone being exposed to decades of chronic pain, medical trauma, like a PTSD brain. You know, they're hyper vigilant. Your nervous system is always going to be on high alert, is going to be scanning for symptoms. Um, these signals going from bottom up, so from your organs up into your brain, are saying pain, 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 pain. So it's interesting because you see women who have 100% of their endometriosis removed, all the lesions removed, yet they're still feeling exactly the same symptoms. And you can't help
Wow.
but think, with all this research coming out that chronic pain changes your brain, that there is this neuroplasticity and your brain's wired in a way that you're stuck in that hypervigilance pain mode, essentially. So it's almost about relearning. So I'm really passionate about nervous system rewiring programs because we can literally change the architecture of our brain by the thoughts that we think. So I'm not saying all the pain's in your head. I'm saying because of all the pain and the trauma, and I experienced this medical trauma, gaslight. What do you think happens if you go, undiagnosed for 12 years and you're a young girl and you're going through big changes in life and you're struggling and you get told it's normal, you know? You can't help but think the effect that has on someone's mental health and their nervous system. So yeah,
Yeah.
a lot of relearning to be safe in your body, that your body's a safe place to be.
And also, just thinking in a cardiac perspective, that chronic underlying stress of that nervous system constantly being in that sympathetic state is just releasing cortisol, which releases all those inflammatory markers, which is again connected to what you've just been saying with inflammation. So there's another reason and another trigger that causes that constant chronic inflammation. It's just that heightened cortisol all the time.
Yeah, so there's cortisol, and then you look at other neurotransmitters like glutamate, and you look at these pain pathways that are just being like on a loop, essentially, even without the lesions there. So yeah, absolutely nervous system work. Whether that be somatic therapies, like involving touch and movement, or talk therapy, or a combination of all. But it's yeah, I'm very passionate about the holistic approach to managing endometriosis.
And being the holistic approach, I noticed too that you've managed with your endometriosis to reduce, if not eliminate, medications and even reduce and eliminate pain. So, can you talk us through how you've managed to do that and how you can help others manage to do that?
Yeah, so I'm extremely delighted to say that I live pretty symptom-free from an endometriosis perspective. Um, I did have some ovarian pressure and pain recently, which we discovered was actually vascular issues and pelvic congestion syndrome, which I can touch on in a minute. But yeah, so you know how I mentioned earlier it took me 12 years to get diagnosed? So I got the operation, and finally, it's like as though everything made sense. Everything made sense. And then from then on, I was committed, wholly committed to healing. I mean, we can never say we can cure endo, but I was committed to my healing journey. And I was all in, and I was like, I'm gonna do whatever I can do. And I knew these things. I knew the inflammation, the nervous system, the gut, the hormones, everything. So I just embarked on this like quest to leave no stone unturned. I was doing everything I could from a naturopathic perspective, food-wise, environment, nervous system. I was getting help from traditional Chinese medicine doctor using acupuncture, which I love also. If someone doesn't mind needles, I mean, acupuncture is great. Um, Cleaning up my environment, I mentioned that low tox living, all the plastics and endocrine disruptors, even makeup and skincare and all these things in our environment that can disrupt your hormones and drive inflammation, and just really um, limiting ultra processed foods. And then I had a very personalized protocol when it came to supplementation and herbal medicine. But as for the foundations and the basics, like I said, endocrine disrupting chemicals are huge because they're coming in from, outside sources and they're messing with your hormones, driving inflammation, nervous system, your stress, gut health, and yeah, hormones, all this stuff is going to mess with your hormones if you're, drinking out of plastics and heating things up in microwaves and plastics and hot plastic water bottles and
Are they the examples of endocrine disruptors that you're talking about?
so phthalates and BPA and um yeah, there are things there are even ingredients that I believe we don't even know the effects of yet on our hormones. So if anyone wants to look up the list of endocrine disrupting chemicals, there are lots and lots of them. And they're just about, in everything that's like a plastic or even like conditioners and gosh.
Shampoos, conditioners, makeup, soaps, detergents, washing liquid, cleaners. Yeah. And I think because you had the skill set being a nutritionist and a naturopath, that once you had that diagnosis, that's when you could go all in with that skill set and experience that you had, isn't it?
Yeah. So that's basically what I did and what I was committed to. And yeah, I saw dramatic improvement. I'd also like to say that I had a really good surgeon. So it's no secret in the industry. There is no gold standard to endometriosis surgery. There's ablation and then there's excision. And ex ablation is simply kind of burning off the top, whereas excision is complete removal of the endo lesions. So that's what you want. So women are getting surgery after surgery a lot of the times because they're not getting the right surgery. So I was extremely blessed in that I had a really good surgeon who did excision properly on me.
Yeah.
So after that, I had a clean slate and I went, okay, I'm going to do everything I can to prevent regrowth. You know what I mean? That was my mindset.
Right. Because is there a percentage, and what is the percentage of regrowth, even after excision?
Gosh, I don't know the exact stats. And different surgeons will have different stats as well. Like some surgeons will say, oh, only 5% of my patients will have regrowth. But I don't know the exact stats. I'm sorry. I know that it is a lot more likely with ablation. So ablation is when you see it coming back a lot more.
Right. And is there any link between endometriosis and things like copper and zinc as well? Is there?
So copper overload and so copper and zinc, I just want to explain to anyone listening or watching, they're antagonists. So a lot of people we see with like an estrogen dominant picture will have more copper and a zinc deficiency. So whether or not that will then translate to endometriosis, I don't know, but we definitely see it more when someone has low levels of copper and high levels of copper and low levels of zinc.
And why is that? Why would somebody get such a high and such a low in these?
Yeah, so there is a condition called pyroluria where as a byproduct of hemoglobin metabolism you make these pyrroles, and in some people they make an excessive amount of these pyrroles, and when they urinate them out it drags along with it zinc and B6. So they end up in a zinc deficient state and copper ends up really high in relation to the zinc. So yeah, and
Right.
zinc is also a really important mineral for hormone metabolism. So it's very important.
There's that link again, isn't it? The hormones, inflammation.
Yeah, zinc is one of my favorites um for kind of balancing out estrogen, well, magnesium and zinc for balancing out that estrogen progesterone ratio.
Well, it's fantastic that you basically can live that life of no pain and no medications in that for endometriosis is incredible.
Yeah, so when I had my surgery, the surgeon was pretty adamant on inserting a Mirena IUD during the surgery. And I said, look, I'd really love to have a chance of feeling what my new normal is like. I wanted to see how it would respond to getting the lesions removed. And he said, okay, I'll give you 6 months. And if you're still not coping, he gave me a script for endo, and he said, if you're still not coping, then we'll put in the IUD. I said, fine. I was like, this is my challenge. I'm gonna
Yeah.
do this. And I never went back. So yeah. And I haven't
Fantastic.
taken opioids for a very, very, very long time. So
Secondly, I'd like to talk about a condition that you have called POTS, which is postural orthostatic tachycardia syndrome. And posture meaning the posture you're in, and orthostatic meaning from sit to stand positioning. Tachycardia is a heart rate of greater than 100 beats a minute syndrome. So for you, and predominantly with women, it is simply from sit to stand, and your heart will go absolutely racing. So, and it can be quite a debilitating syndrome that happens, and predominantly with women. So, are you willing, and would you mind sharing with us when did this onset occur, and how old were you, and how long did it take you to be diagnosed?
yeah, so I thought my big issues were kind of resolved after we had endo removed, and I was like super happy that I finally had answers. And then I conceived naturally within a year, which was all happy and great. And then I hit my third trimester and I went for a walk. I went for just a normal walk. And when I got home, I was feeling like I was going to faint. I was super breathless. I was in, pre-syncope. And for anyone listening and doesn't know what that is, it's that feeling before you're going to pass out. Your ears are ringing, you kind of feel nauseous and dizzy, and heart's doing weird things. Um, and I was like, this is not right at all. Something's really wrong here. So the third trimester of my first pregnancy was when I first developed POTS symptoms. Now we know that POTS can have a trigger like that, like pregnancy or an illness or a vaccine or a virus or whatever it is. So we know that about POTS. So my trigger was pregnancy. So that entire third trimester, it was really, really hard because I was I was basically horizontal, because every time I was upright, I was yeah, like you said, it's called POTS, but it's so much more than tachycardia. It's so much more than that. And I got diagnosed pretty quickly because I kind of knew it was such a dramatic postural heart rate change that it was just so blaringly obvious that it was like, okay, whenever I go, that I knew exactly what to tell my doctor. Every time I go from laying or sitting to standing, my heart is just going so, so, so fast, and I feel like I'm going to pass out, don't have enough oxygen to my brain, and I can't like stay conscious, basically. So they were like, oh, it sounds like something called POTS. And I was like, okay, great. What does this mean? Um, and at the time, I was living in Melbourne, and I was, in the public system, having going through care for my antenatal care for pregnancy, and I really wasn't getting much help. Now, this was 11 years ago, and there wasn't much knowledge about POTS back then.
Mm.
I mean, only now it's starting to really um, gain traction. So it was really, really hard. It was really hard to get support, and I felt very isolated. I ended up even having a consultation with the dysautonomia clinic in New York City because I was like, I have no one to talk to about this. I don't know what to do. So, yeah, I was kind of just told the same thing because I was pregnant. It was like, take lots of salt tablets, wear compression stockings, stay hydrated, and don't do anything that'll trigger your symptoms. And I was like, great. They didn't want to give me a beta blocker at the time, so I didn't start that then. Um,
Can we just explain to the audience? Can we just break that down? Compression stockings to get your venous return back up to the heart, to get the blood back up to the heart, and then you spoke about a beta blocker, and that's to get your heart rate down. Um, and then you talked about increase your fluid intake, and that's again because the salt as well, and that's to retain your fluid volume, and also to increase your fluid, wasn't it? Because your blood pressure drops as well. Is that right? Mm.
Yeah, well, see, that's the thing with POTS. Not everyone's blood pressure does drop. That's more of like a orthostatic hypotension type of situation. In fact, most people I see with POTS have a bit of a blood pressure bump up because of the tachycardia.
Mm.
So, yeah. So yeah, I had like resting low blood pressure, but when I was tachycardic, my blood pressure would rise. It was very uncomfortable. Um,
And let alone you're in your third trimester of pregnancy as well. That would have been doubly difficult.
I couldn't breathe. I was suffocating. My heart was going so fast. It was just awful. All of it was awful and very traumatic. So yeah, I was kind of in this headspace of I just need to get to the end. I need to survive this pregnancy and just give birth to this baby. And I felt better after the baby was born. But then I kind of flared really badly a year in, and that's when all the diagnostics came into it. So that's when I did all the workups. And then they discovered I actually have prolonged QT syndrome also. So put on a beta blocker. If anyone is wondering what prolonged QT syndrome is, it's basically a type of arrhythmia or heart rhythm disorder that can cause a fatal arrhythmia.
Mm.
So it was very confronting, all this stuff was happening. You've just had a baby. It was just, yeah, it was very, very very challenging. So, did the autonomic tests, got basically diagnosed with dysautonomia, you know, autonomic dysfunction of your autonomic nervous system. Something was going on with my autonomic nervous system, which meant that my heart rate, blood pressure, digestion, breathing, none of it was regulating properly.
Which is the autonomic nervous system is responsible for everything that's involuntary. Like you just said, your heart rate, your blood pressure, your temperature, your digestion. It's things that we don't have to think about that our autonomic nervous system handles. But there's that dysfunction, which is what POTS is, isn't it? Is a dysautonomic syndrome. So how did you cope with, like, we sit to stand so often in a day? How did you and how do you still manage that simple function? Like, how symptomatic are you?
So I went through, I've been through different seasons of severity of this. So around the time of my flare, um, so I was inpatient. I was inpatient for 3 weeks, and then I was in inpatient rehab for 1 month, and then I was outpatient rehab for 12 weeks. So that's quite a long hospitalization. And I was 25. So I was the youngest person in rehab by decades. I mean,
Wow.
you know that environment inside
Yeah.
out. I was just like, oh my gosh. Um, so yeah, I was totally wheelchair bound, bed bound, at that point. Um, Even like, yeah, and that's when we were trialing different meds and getting lots of like IVs. So I've tried a bunch of different medications. Um, so there are glucocorticoids, which mimic your aldosterone, which helps to retain more salt and more fluid. So taking that with more salt and more fluid and compression, but that made my potassium levels drop too low. And then with prolonged QT syndrome, sent me into ER, and oh, it was just awful. Um, tried beta blockers. I'm still on a beta blocker, which has been helpful. So the challenge was and is with a beta blocker, if you have a resting low blood pressure, the beta blocker slows down your heart rate, but it's made for high blood pressure also. So it's going to tank your blood pressure. So there's this kind of tug of war between like making sure you have a low-ish heart rate and don't tank your blood pressure too low. But there are other medications. There's a medication like ivabradine that people use a lot for tachycardia also, which doesn't tank your blood pressure. But because I have the prolonged QT syndrome, I have to be on a beta blocker. So
So are you on the metoprolol low dose?
I was, and I have switched to a propanol. I was on a very low dose of metoprolol. So I was on 12.5 milligrams twice a day, and now 10 milligrams propanolol twice a day.
Okay. And just any more symptoms? What about when you're standing in a supermarket? How is that?
I hate standing in a queue. That's like one of the worst things you can do to me is put me in the hot sun and make me stand up and talk.
Right. So
Temperature
therefore temperature.
dysregulation, awful. Heat, awful. Australian summers, awful.
And yet you're living in very North Queensland, which gets extremely hot.
I know, I know. But again, it's because we need family support because my kids are extremely healthy, active kids. And with POTS, it's very limiting physically because, when you have little kids and you have to constantly bend over, pick things up, like it's very triggering for my symptoms. And it's not just in the moment, but it may sound silly. I don't know, hopefully no one watching this judges me, but it is really hard to be a mother of young kids with POTS. If you're, days on end feeling like you're going to faint just from doing little things. So yeah, hanging out, washing in the sun, standing in a queue. So I have my little hacks, like using a, shopping trolley rather than not using a shopping trolley. Counter maneuvers like calf exercises, getting on your tippy toes, wearing compression tights all the time, um, staying hydrated, hydrolyte, salt sticks, you name it,
Yeah.
all the things.
And is there a specific diet that you adhere to for POTS?
Okay, so yes, I try to eat a high salt, high protein diet, trying to avoid refined carbohydrates, white carbs as such, because that can also cause a lot of, blood sugar peaks and drops, and that doesn't go well with POTS symptoms. In fact, a lot of people with POTS have reactive hypoglycemia. Um, so, lots of protein, lots of fiber, if possible. And avoid the ultra processed white foods, really.
So I just don't know how you do it because you're a mother, you've got three beautiful boys, you also work in your own private practice, and yet you've got these complex health issues that I don't know how you do it. Like you just say, standing in a queue, it's diet. And I know so many people that with POTS, it's so debilitating, they feel like they can't even work. And yet you're maintaining a household and working. How do you do it?
These are the things, like I work from home. I have the privilege of, I mean, this is how I have set up my life so that I can still do what I feel I'm called to do in this community, with my conditions and my diagnoses, whilst not compromising on my parenting and my marriage and relationships and friendships and so on and so forth. So, really healthy boundaries, looking after self. Um, Lots of support, calling on support. I'm not a people pleaser. I've learned to let go of that a long time ago because um, you can't be a people pleaser if you're dealing with chronic health conditions.
Yeah.
And yeah, asking for help when you need it, but also really having a good solid team, medical, allied health, so on and so forth, to look after you.
And
And
Kim,
also
can you
like
exercise?
I personally do not do any structured exercise as such. I would love to be able to like play a game of basketball or something like that, but at right now, like just looking after my kids is very is
Is
exercise. Yeah,
yeah.
yeah. It's quite yeah, and we can delve into like the hypermobility stuff too, where we talk about like vascular issues, joint and musculoskeletal issues, because that in and of itself is quite debilitating too. And a lot of people with POTS have these comorbidities.
I'd love to. And look, I definitely know there's a part two to this because of the other health conditions that we haven't even talked about. But I so thank you so much for your time. I just think what you're doing in this space and that you're helping people as a nutritionist and a naturopath is just so essential in this space. So I just love talking to you.
Thank you. Thank you so much for having me. Thank you so much.
You're welcome, and we will definitely do a part two, okay? Because it's been just fascinating listening to you, and I know you can help lots of people. So before we go, how do people find you, Kim? If they have any of these symptoms, how do they find you?
Yeah, so if anybody is looking for me, my social handle on Instagram is Endo Naturopath. One word, all small letters. And if you want to look at my website, it's endonaturopath.com.
Lovely. Thank you so much. It's been an absolute delight to see you, to meet you, and we will definitely talk again.
Likewise, take care.
So if you liked this podcast, please like and subscribe to my podcast, Heartcore Junction. Alternatively, you can also follow me on Instagram. It's heartcore.group and follow me on Instagram. Or otherwise, you can also book me for a workplace seminar where I'll come to your workplace and we educate on cardiac disease risk prevention and also the other diagnostics that are available today and blood work that can be done. Again, just look on my website, www.heartcoregroup.com, or email me on info@heartcoregroup.com. Thanks very much for watching, and until another episode, see you soon. Thank you.